Nigeria's health sector, which is critical to the nation's human capital development, has had its own fair share of challenges in 2023, ranging from a change in administration, which led to the implementation and new initiatives and the eradication of others, disease outbreaks, strikes, and the issue of brain drain, to mention a few. Speaking with TV360 Nigeria, citizens share their thoughts on what year 2023 has been for the health sector. TV360's correspondent Chidi Igwe has the report.
Nigeria is Africa's most populous nation, with over 200 million people based on Worldometer's elaboration of the latest United Nations data. It's a vibrant country full of entrepreneurial energy and talent, but it's also a country affected by poverty and disease. In the year 2023, the Nigerian health sector, which is crucial to human capital development, has had its own fair share of challenges, ranging from a change in administration, which led to the implementation of new initiatives and the eradication of others, disease outbreaks, strikes, and the issue of brain drain, to mention a few. On the 12th of December 2023, Nigerian President Bola Ahmed Tinubu launched the Nigeria's Health Sector Renewal Compact between the federal, the 36 state government, and development partners. It was a significant step towards achieving universal health coverage, UHC, and improving access to healthcare. Health expert Fumi Akinola applauds the initiative, hoping that funds from the initiative will help revamp Nigerians' primary healthcare.
So far, the data, there was this data on the internet that talked about only 20% out of the 30,000 primary healthcare centers that we have are being utilized and doing what they're supposed to do. So I think a lot still needs to be done, and that is why I believe we are glad that the present government, federal government, is thinking about universal health coverage, that they are open to sign with all other state government and funding agencies, and particularly with the creation of the National Investment Initiative.
As the first points of medical care at the grassroots, governments at the state and local government level are expected to make the primary health care centers a priority while the health workers are monitored.
Government should just try to put more orientation to staff, the doctors, midwives, how they are taking care of the patients that are, especially emergency.
These primary health care centers are there all over the country, so they should be looked into, upgraded, staffed, trained staff should be sent there with adequate salary. And of course, like I said, housing, water, and there must be monitoring and evaluation.
During the course of 2023, Nigeria faced battles of warding off some epidemics from diphtheria, Lassa fever, anthrax, and cholera, just to mention a few. But an expert says these are inevitable.
The reality is that disease outbreaks are a part of our world. And regardless of sometimes whatever you do, they will occur. So it's not because of negligence when you start work, but it's just the normal course of nature. Now we know that there's a lot of population growth explosion. People are sort of like encroaching into the domain of some of these organisms, and there's more interaction between human beings and various microorganisms. So outbreaks are bound to happen.
He added that compared to previous years, Nigeria has controlled disease outbreaks better.
As a country, I think we've moved in the upwards direction. There's still a lot of room for improvement, but I think we have become a bit more skilled at responding to this thing. And probably many of this is culminated with the COVID pandemic in 2020, where the WHO actually ranked Nigeria very highly in terms of successful responses to the virus. We were ranked, I think, as high as 4th in the entire world, which is really a major achievement that shows that the country has learned from previous epidemics.
Recurrent challenges for the health sector are issues of multiple strikes, which has been a barrier to the growth of the sector, and brain drain, also known as Japa, that has seen Nigeria lose its medical personnel, which are not enough to serve her population to developed countries. In a bid to stem this tide, the Federal Ministry of Health, on the 5th of October 2023, issued a circular which says that the Nigerian government had approved the appointment of retired doctors nurses, and other clinical healthcare workers on contract, which will put them on the same salary scale level they were before they retired. Reacting to this, a dean of health sciences at a Nigerian university says the initiative is a stopgap policy that only helps in the interim.
The challenge is that they're going to be overwhelmed because the more you train younger professionals who are more inclined to live in the system, the more you are left with the older ones who are due to, enjoy their retirement. And they cannot cope with the pressure over time. But on the interim, and in the interim, I think that it's a quick fix policy that may likely work.
In spite of the reasons Nigeria keeps losing its doctors and other professionals to the Japa syndrome, a citizen says some health practitioners are returning.
For me, for anyone who is really willing to leave the country, should be able to measure up and define what is success for me, out there, and then what is success for me right here. So as much as people are also leaving the country, don't be surprised. Many are actually coming back to take up those roles and earn better pay.
Professor Ibeneme also urges the government to find a lasting solution to this human capital depletion.
The need for a greener pasture, better salary, better condition and quality of life for themselves and for their family. And, availability of technology, which they need to practice. It is very frustrating for you to see your patient die when you know you can do, you have the competencies, you have the skills, you have everything it takes to keep your patient alive, improve the health of your people, but you don't have the technology available to you. You don't have the equipment. You don't have all you need to function. It frustrates a medical practitioner.
President Bola Tinubu is 7 months into his 4-year tenure, and morning shows the day.
The health sector itself is something, we just hope that, yes, there's a new administration. Pate is not new. It's been there before. So everybody is hoping that something is going to change. Okay, let's say he's bringing in his idea before into this government. But the whole thing is that I don't see him doing anything special because the person that appointed him, most of these appointments are not based on merit. And he will not be able to shake up the system. And if they want to revitalize the health sector, there are steps they know. It's not something we should advise them because I know everybody in Nigeria knows what is wrong with Nigeria and they know how to fix it. But it's just that if I fix it, what will I be telling them in the next election? So they will believe, let's keep it like that. Next election, we'll still brainwash them and tell them we are doing something.
I think we need to give them more time to see the fruition of what they are doing. Remember that health is not something that you see returns immediately. It takes time.
Despite its ups and downs, the year 2023 offered a glimmer of hope for what is to come in 2024 if the government can walk its walk by continuing to push solution-based policies that can put behind us the dark days in our health sector. Chidi Igwe, TV360, Nigeria.